Hi, I'm Ashley, or I'm here at BioSpring in Lisbon, and today I'm speaking with Daniel Chancellor, VP of Thought Leadership and Evaluate. Thanks for being here today.
Yeah, it's my pleasure. I've been to many Bio Springs before. First time in Lisbon though, which is great, a lovely place to be.
So you had a talk yesterday that you moderated. Tell us a little bit about that and how it went.
Yeah, that's right. I was lucky enough to be asked by the organisers, well, asked again by the organisers. I've been here a few times. Gave a talk on really high-level therapy area trends. These conferences quite often run sessions, specifically about what's going on in cancer, what's going on in neuroscience. But the view that I took was actually how these areas competing with each other. Because reality is there's only a certain amount of funding, and when you're a large pharma company, you're trying to think, well, where am I going to put my bets? Is it going to be A or B? And sometimes B comes at the expense of A. So I think there's an interplay going on, which isn't necessarily spoken about that much.
I know in the talk yesterday you shared some data on therapeutic trends. Tell us a little bit more about that.
Yeah, we dived into some of the data that we have here at Evaluate and shared basically how these therapy areas are sitting relative to each other. No surprise, the largest therapy areas, the cancer market, the immunology markets, these have the largest kind of prescription drug sales. They've grown tremendously in the past and they're continuing to grow. So these are the areas that continue to attract the most interest from the audience here and certainly the large pharmas and investors. They're all looking for the next assets in these spaces. That's well known, but what isn't necessarily as understood is, what's the direction? So with that, we shared some pipeline data. Where are companies adding new drugs to the pipeline, but also where are drugs falling out of the pipeline? And that's not necessarily a story that's told so much. And in our data, I've spoken about oncology being a really high area or an interesting area, but we're seeing a lot of drugs falling out of the cancer pipeline, more at a faster rate than they're actually being added to the pipeline. So within our data that we shared, there's certainly industry trends can be quite slow moving, therapy areas trends can be quite slow moving, but we're seeing signs that there is a direction of travel towards new areas, certainly cardiovascular disease, metabolic disease, neurology. There are areas that certainly are on the way up, and so this is where we see as the future direction of the industry, and I like to think we told a story that isn't necessarily as widely known.
Okay, interesting. And in regards to the panelists in your talk, do they have any surprising thoughts on the topic? Tell us a little bit more about what they thought.
Yeah, I think there was broad agreement with the data that we shared. The way we presented, this is what the industry looks like. A lot of the organizations that were on the panel, so we had large pharma represented, their portfolios mapped pretty consistently with, certainly they're all interested in oncology, they're all interested in immunology, but they're also looking on the peripheries, how can they differentiate? But what surprised me was they're not necessarily have a top-down strategy in terms of, right, well, I know this is a new hot area that I want to move into, let's go find drugs in that area, or let's see how we can move into it. It's actually more bottom-up, the consequence of, let's look at what's out there, let's broaden the aperture as much as possible. These guys have really big teams of like specialist search and evaluation people who are very critical and good at appraising the science. And they cast the net as widely as possible. So while these big companies have focuses, they're not necessarily thinking about how we can move in a certain direction in a preordained way. It's actually they're listening to what's happening on the ground, building that strategy right from the bottom up. And the consequence of what might be a longer term strategy is really built at meetings such as this and those really small interesting conversations that they have. And it might be that if there are a few conversations that are clustering in a new area, that then might result in what becomes a bigger corporate strategy in 5 or 10 years' time.
Well, thanks for speaking with me today.
Yeah, my pleasure.